Welcome, ladies, to our weekly live stream. Hello, Greg and Renata. How are we? Do you want to say hello?
Good.
Is that you, Greg?
Yeah.
Hi. Do you want to put your camera on?
Yeah, my wife's got the phone.
Hi, Renata. I love this. I can hear your husband's voice, but I can see you. Go team. How you doing? Great. Great. Speak to me. Hello, Greg.
Oh, I'm okay. We're gonna go for a walk.
Oh, nice. Yeah. Well, Greg, I value your input because you've got that pharmacy background, and it's lovely that we can merge integrative medicine with the Chinese medicine. So I do value your input. Thank you for joining us. Yeah,
Glad to
welcome.
be here.
Awesome, great. All right, Jamie, do you want to say hello? Do you want to unmute yourself and give me a little wave? Give me a little wave.
Hi,
Hi, Jamie.
good evening.
Can I see your beautiful face, darling? I feed off your energy. Just even it's a 2 second.
Here.
Shall
Yeah, I have my pants on. I don't know if you can see me.
I can see you. Yeah, so beautiful. Hi. How's your week been?
I've got my little candlesticks.
I love this.
They're fake, but they're like battery powered.
It's great. I love this.
I like them.
I like it. It's lighting up your life. And having you here, it lights up my life. So welcome aboard. Welcome aboard, darling. Doa, do you want to say hello? Or Jessica, do you want to say a quick hello? Who wants to say hello to me?
Hello, Dr. Fiona.
Hello, Jess. Show us your face. Beautiful. What's happening?
Oh, there, if you could see me. Not much. I just literally got done with work. It's been such a crazy busy day.
It's been a crazy time. From this big super giant moon that we had last week, it was like, whoa, this gravitational pull on all my patients. And I don't think the momentum stopped for any of us.
Yeah.
So welcome, honey. It's so good to have you. I love your energy. Yeah. Welcome aboard. All right. I think I'm going to make a start, ladies and Greg. So I just want to welcome everyone. For those of you that haven't met me before, I'm Dr. Fiona Tassoni, and I'm a doctor of Chinese medicine specializing in fertility. And I'm just so glad that you could all join me today. So today we're going to dive into a topic that's on the minds of many women over 40, and especially when you're trying to conceive. And it's all about understanding your low AMH and high FSH levels. Now, these numbers can be alarming. They can be alarming, but I want to bring some clarity. I want to bring some hope to this discussion. So just some housekeeping notes before we begin. Just a couple of quick reminders that I want you to just, mute your microphones during the presentation. And if you have any questions, please turn on your camera. I really feed off your faces, and turn on your camera at the end of the session, and I'll address them in the Q&A session at the end. So stick around. All right, let's start with AMH, or the anti-Mullerian hormone. All right, I'll explain what this hormone is, how it's produced, and just what low levels might indicate about ovarian reserve. So the AMH test, it's a blood test, and it directly measures ovarian reserve. So higher levels above 1 are favourable, while lower levels, less than 1, indicate decreased ovarian reserve. Now, AMH is produced by the granulosa cells, and that's in the ovarian follicles. And specifically, AMH is secreted in the small developing follicles in the ovaries, all right, known as the preantral and the small antral follicles. All right, these follicles, they're not yet large enough to be recruited for ovulation, but they're still in the early stages of development. So what the AMH does, it plays a key role in the growth and development of these ovarian follicles. Now, the test itself, now this is the largest takeaway that I want you to really listen in. All right, it's a test. It's an indicator of the preantral follicles in the ovaries, but it's more of a routine test for IVF, because they need to estimate the number of eggs that you may produce, and that information, all right, it's that information about how many are produced, and that's used as a way to gauge and predict how you will respond to the ovulation stimulation drugs. So it's not a test for equality. All right, that's the takeaway. It's not a test for equality. In fact, there's no test for equality. The only way to know if an egg is chromosomally normal is to attempt to fertilize it and then perform a genetic test on the embryo. So while the test, the AMH test, it can inform women about their chances of harvesting eggs, and this is for freezing and for IVF purposes, it's not a predictor of the quality of your eggs or your ability to get pregnant naturally through sex. Now, if you're doing IVF, well, clearly, you know, having more eggs at IVF retrieval provides a greater opportunity and higher chances for these eggs to fertilize. All right, but the AMH test, it's not a predictor of your fertility in any manner. That's the biggest takeaway. It's not a predictor of your fertility, okay? I wish we could actually dispense with this test, because it's what everyone brings this test to me, and they're all freaking out, and it's putting so many women in a perpetual state of stress, and it's putting them into this state of uncertainty and fear, and you know, it's just not necessary. So it's definitely a test, and it's the best measure we have as you start to hit the perimenopausal and menopausal transition, and it might be useful for predicting, you know, things like ovarian hyperstimulation syndrome, the effects of chemo, and in determining, you know, a diagnosis like PCOS, because with PCOS, you know, you'll have really high AMH levels. That's what we see with PCOS. So I just want to note that low AMH, you know, you just need to know that even with an AMH of 0, as long as you are ovulating, right, it means that you can get pregnant naturally. So remember, you just need one healthy fertilized egg to get pregnant. All right, 1 + 1 = 2. There we go. It's that simple. Now, some of my patients who did IVF, and you know, they were able to conceive even though they only had 2 or 3 eggs retrieved. In fact, one patient, I remember she was absolutely devastated because she only retrieved 1 egg, and I said, you only need 1 good one. Well, guess what? It was amazing, because they transferred it, it stuck. She's got a beautiful baby boy. And, you know, she was like, you know, late 40s. So, you know, this was a wonderful story. So let's look at FSH. We'll talk next about that. This is your follicle stimulating hormone and its role in the menstrual cycle. I'm going to discuss how high levels or low levels can be a concern and what it means in the context of fertility. So it's the main hormone involved in producing mature eggs in the ovaries, and it's another gauge of the ovarian reserve. Now, if this test reveals excessively high levels of FSH in the body, it's a signal that your brain is trying to boost your poorly performing ovaries into action. So in other words, the ovaries, they're going to need a bit more help, extra help to make the eggs. So women with the high FSH, they generally, now this is a generalization, do not respond well to IVF stimulation protocols. Okay, when the ovarian reserve is low, the ovaries may not respond as effectively to the medications used in IVF to stimulate the production of multiple eggs. All right, so this can result in, like, you know, a lower number of eggs retrieved during an IVF cycle, which can reduce the chances of a successful fertilization and pregnancy. But, you know, I just want to note this. I've had so many patients with high FSH, and then, you know, they've gone on to actually conceive with the IVF process. So, you know, there's lots of things to consider just with, I think that we don't want to isolate FSH and AMH. It's like we need to look at in the broad umbrella of your other, you know, reproductive hormones. And you need to also consider, you know, your overall health. You know, what's the environment like? What's your stress? And also, it's about tailoring your IVF protocol if you are going down that route. So some of the common misconceptions, I'm going to discuss these because there's a lot of misconceptions about AMH and FSH. It's like probably one of the biggest topics that we have in fertility. And I'm going to debunk some of those common myths and explain why these numbers, they're just part of the bigger picture. So we've got to look bigger picture. I want you to take an eagle's view and look down, okay? So myth number 1, low AMH means you cannot get pregnant naturally. All right, low AMH levels do indicate a lower reserve. We've explained that, haven't we? But it doesn't mean that, natural conception is impossible. It's, the quality of the egg is more important than the quantity. I've explained that. All right, so even with low AMH, if there are a few eggs available, but if they're of good quality, pregnancy is still possible. 100%. It's about having that one healthy, good egg and one healthy, good sperm. So myth number 2, while high FSH means you will not respond to fertility treatments. Now, let's debunk this. While high FSH levels can indicate that the ovaries are not responding well as they should, it doesn't mean fertility treatments don't work at all. Every woman's body is different. And I think that's the huge takeaway. We all respond differently. That's why our protocols are also different. And our responses to fertility treatments can vary. So sometimes it's just about adjusting the protocol, or adding in supportive therapies like acupuncture can make a significant difference. In fact, I've got a study, and one study, it's very famous, and I can, if anyone needs me to DM you this study, adding acupuncture to an IVF protocol can improve your chances of success by 65%. Myth number 3, AMH and FSH levels are static and cannot be changed. Well, let me debunk this, because they fluctuate all the time, right? I had a patient in January, her FSH was 57, then it went down to 19.2 in March. They fluctuate. They can fluctuate daily. They also fluctuate at different parts of the cycle. So, they fluctuate partly because, we've got factors like stress, sleep, and your overall health. We've also got lifestyle changes that you're making. Like if you're doing the fertility coaching with me, like I've seen changes which are extraordinary. You make the lifestyle changes, you make the dietary improvements, you apply the supplementation, boom, there's the magic. Okay, so for example, vitamin D, like sunshine, let's think of sunshine. Vitamin D and DHEA supplementation can support AMH levels, and it can reduce stress and balance hormones, and can help manage high FSH. Now, DHEA is not for everybody. It needs to be tested before you supplement. It's not like a broad umbrella, let's all take DHEA, because I see so many women on forums and they're like, oh, I'm just going to throw DHEA into the mix. Even with the vitamin D, let's look at what climate you're in. You don't always need to supplement massive doses, but let me tell you, 80% of people that I work with are depleted in vitamin D levels. Even people that are living in places like California and warm tropical climates, like, St. Lucia, they are depleted. So we need to look at these levels. And if you apply the supplementation, the magic starts to happen. We like plants. If you put the ingredients in, we start to blossom. Look at my flowers back there. So, we're all these little roses. We can bloom and blossom with the right lifestyle changes, dietary improvements, supplementations. All of these things can influence the outcomes. Myth number 4, AMH is a direct indicator of your ability to conceive. You all know the answer to this. No, it's not a predictor of your ability to conceive naturally. It's primarily used, as we now know, we're learning this, it's to estimate your ovarian reserve and inform IVF treatment plans. Okay, so if you're doing IVF, you need to know what your AMH is. If you're not doing IVF and you've got a regular cycle, throw it out, burn it. I say burn it. It's irrelevant. It's going to distract you from the work that we need to get done. All right, so a woman with low AMH can still conceive naturally, especially if her egg quality is good. So the focus needs to be on your overall reproductive health rather than just your AMH levels. Myth number 5, high AMH always indicates high fertility. I'm going to debunk this because, we've got conditions like PCOS and the AMH is really high all the time. Now, women with PCOS often have small immature follicles that produce lots of AMH, but that doesn't necessarily correlate with better fertility outcomes or better egg quality. You know, high AMH in the context of PCOS is also associated with anovulation, which means that there's no ovulation, lack of ovulation. So that's where the ovaries don't release eggs regularly. So this is not a sign of high fertility, is it? Okay, myth number 6, low AMH and high FSH levels mean menopause is imminent. Now, while low AMH and high FSH levels can indicate that perimenopause is approaching, it does not mean it's immediately around the corner. As you can see, now I'm going to go into some case studies further down, but I've seen these levels go from, you know, and people say, oh, have you reverse engineered, you know, perimenopause for me, Fiona? No, it's just I treat the intelligence of the body. And it's amazing when the body comes back into balance. I've seen the most extraordinary things happen. Now, these IVF doctors, a lot of them, and Big Pharma, they're going to tell you, you can't do it. It cannot be done. Well, I work with this every single day, and I'm seeing these results and these sliding shifts that happen with women over 40. It's about trusting in your body and trusting the process. I think that's the biggest takeaway. Just know this, perimenopause and menopause, it's a gradual process. And these levels are just part of a broader picture, okay? Myth number 7, FSH levels are the most important factor in determining fertility. It's not the only factor, is it? It's one factor amidst all your other reproductive hormones. And we've got to get them all into balance. We've also got to look at the health of the uterus, you know, your fallopian tubes, the quality of the sperm. The sperm, we always forget about the sperm. We think it's all just about us, ladies, but the quality of the sperm, you know, when I start working with patients now, I always test the sperm first because it's the one thing that we can fix really quickly. So the semen analysis, you know, where we're looking at the count, the volume, the morphology, the motility, these are the parameters I need to see. And we need to look at these. It's not, so FSH is not the only determining factor. Sperm is a massive part of it. We've got a declining sperm count globally. So, and we need to look at the overall lifestyle factors, all right, because they play crucial roles in sperm and male fertility. So, you know, let's look at the last myth, one last myth. Fertility treatments are the only option for women with low AMH and high FSH. I think this is a big one because I just see patients coming to me and every doctor just says, if there's a problem, IVF. If there's a problem, IVF. If there's a sperm problem, IVF. Do doctors know that you can do acupuncture and Chinese herbal medicine? No, because they're not trained in that niche. They're not looking at it through that lens. They're trained to refer you straight to IVF. And so it's not just Chinese medicine. We've got naturopathic herbs, we've got nutrition, we've got nutritionists. There's just a plethora of different holistic treatments you can try before you can go straight to IVF. Because at the end of the day, if you're doing IVF without fixing the problems, do you think IVF is going to work? No. We need to fix the problems first. We need to fix the environment for IVF to be successful. So it's imperative, whether you're going down the route of Chinese medicine, naturopathic medicine, you know, alternative, holistic treatments, kinesiology, whatever balancing medicine or style of treatment that you try, you've got to literally address the problems before going into IVF. And often it's an adjunct. You put them all together. Acupuncture, Chinese medicine, naturopathic herbs, nutrition. Like if you put it all together, your chances of success are just going to be through the roof. So natural conception is still possible, right? And many women benefit from holistic treatments. In fact, I've had people that have done rounds and rounds and rounds and rounds and rounds and rounds of IVF cycles. They come and work with me and we get them pregnant naturally. And they're like, hold on. And what we're normally doing is we're preparing them for another IVF cycle. and they get pregnant naturally. I've had that happen so many times. It's just amazing. All right. And that's where I'll be using acupuncture and Chinese herbal medicine. And I bring, sometimes if I'm unaware, you know, and I need to work with someone that's got SIBO, I might bring in a naturopathic doctor, or I might bring in somebody that can optimize the diet with the FODMAP and you know, structure it and tailorize it. So, you know, integratively, we're working as a team around you. But just know IVF is not always the only option. So let's look at some of the root causes and contributing factors and understanding the root causes of, you know, low AMH and high FSH. All right, so the possible causes of low AMH, we've got the oral contraceptive pill. So when you've been on that, you know, you're shutting everything down, your body's not ovulating, you know, you're having withdrawal bleeds. It's like we've got to train your brain again to actually ovulate. So the pill, you know, post-pill PCOS, I mean, there's so many problems that come with the pill. I was guilty of being prescribed it. I didn't know better when I was young. And, you know, it's not a solution, but it does cause low AMH. And so, you know, we need to fix the problems. So I'm not saying it's bad. And it's certainly a solution for a lot of women, but it's very depleting of minerals. You know, there's a lot of side effects. And, you know, when you go into the preconception phase after being on the pill, we've got to fix those problems first. Smoking, being overweight, all of these things are other causes of low AMH. You could have endometriosis, autoimmune conditions like Hashimoto's. It can be your age. You know, clearly as we grow older, our AMH levels, they naturally decline with age. Your DNA, it could be just genetics or ovarian cysts. You know, on the other hand, high AMH level can indicate a tumor or PCOS. We've also got, you know, insulin resistance with high AMH, and high free testosterone readings and elevated cholesterol readings are usually present with the high AMH. And interestingly, with PCOS, you know, normally I don't tend, the AMH levels don't tend to decline with age. That's what I find fascinating. You know, that's just been my observation in clinical practice. What it's important to note is that your AMH levels, it can just fluctuate. It can fluctuate significantly through your menstrual cycles. We've got lower readings in the luteal phase, which is why, you know, we test the AMH, you know, it's your day 3. We tend to, compared to the follicular phase, they're higher. So we tend to test AMH in the follicular phase. So what can we do to improve your AMH levels naturally? I always like to give you some takeaways, some key things that you can implement straight away. Clearly, we want sun exposure, you know, your waking sleep cycle, you know, open up the blinds, look at the sun. That first 30 to 45 minutes, it's about working on your cortisol awakening response, and that's going to give you that vitamin D. It's through your eyes, you know. We are just covering our eyes with sunglasses, our skin with sunscreen, we're putting hats on. We're actually getting no sun exposure. And we're wondering why we've got these serious AMH levels that are low. So vitamin D, you might even want to supplement with it. 5,000 IU if you are really depleted. Do some blood serum and just find out what your levels are. You might need to supplement 10,000. Sometimes I will supplement 20,000 IU. Now, sun gazing, you can directly look into the sun and do it when the sun's on the horizon. So when the sun is on the horizon, you can look into the sun and you will actually get 20,000 IU if you do a minute of that daily. So, you know, sun setting on the horizon, rising when it's on the horizon. So sunrise and sunset, best times to look at it when it's right on that horizon. What else? DHEA, I mentioned that earlier. So you could look at doing some DHEA testing through blood serum. You could do Dutch testing, which I offer, but you want to actually test that with your testosterone. You want to make sure that you have a base marker, because the levels can go up pretty quickly. And then you want to retest in 2 months, because, you know, we want to get you at the higher end, but not too high or too low. It's got to be in the Goldilocks zone with DHEA. So you don't mess with it. You want to do a supplement review every 2 months if you're taking DHEA. And I would just be really starting at a low dose, no more than 25 to 50 milligrams of that. Like, I think 75 milligrams is way too high for women. So, you know, go in, go low, go slow. Reduce stress. That's going to improve your AMH levels naturally. Stress reduction. Sleep, adequate sleep. Aim for 7 to 9 hours, because that really just helps balance your hormones, particularly melatonin, which can assist in reversing oxidative damage to your oocytes. So we need sleep. It's one of the biggest pillars. Sleep and reducing stress. These are the pillars. You know, work on them. You can't see them sometimes. I mean, I have a patient right now, and she's really struggled because she does a lot of her work late at night, and then she fires up her brain, and then it's really hard to get her into bed before midnight. And so every hour before midnight is worth 2 hours of real-time sleep. So if you get into bed at 10, you get an extra hour. So wouldn't that be nice if we got an extra couple of hours of real-time sleep? So aim to get to bed lights out by 10, asleep by 11, and you're getting an extra 2 to 4 hours of sleep. All right, what else? Eat organic fruits and vegetables. You know, always know nutrition is far superior than any supplement you could ever take. I mean, let's face it. You know, the spraying, the glyphosate, we've done a talk on this. It's quite horrendous. We're being poisoned everywhere we look. We want to wash our fruit and vegetables with apple cider vinegar or some ceolites. So, you know, clean your fruit and vegetables where possible. And, you know, what else? Energy balancing. So this could be acupuncture, qigong, tai chi, chakra balancing, Reiki, kinesiology, reflexology. It could be just meditation, lower diaphragmatic breathing. In Chinese medicine, when I'm working with patients, you know, we'll often apply the femoral massage. It's a simple technique to increase blood flow to the uterus and the ovaries. It's literally occluding the femoral artery. It's like your carotid artery, but it's on your panty line. So look down, look at the crease of your panties, and it's that big pulsing artery, like the carotid, boom, 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 occluded. 30 seconds to 45 seconds, and then repeat the other side. And we want to do that 3 times, all right? And this massage can be performed twice a day from the last day of your period leading up to ovulation, and then we stop. It's a powerful thing that you can do at home, and it takes less than 3 minutes. Abdominal gua sha, castor oil packs. We do this in the follicular phase. And similarly, like the femoral massage, you're doing the castor oil packs and the abdominal gua sha from the last day of your period until ovulation. Then we stop. Then we've got acupuncture and Chinese herbal medicine. So the good news is, although low AMH means that you have a low ovarian reserve, it doesn't mean that you'll not be able to conceive naturally. It doesn't mean that you have bad egg quality, all right? Just know that, even if it's 0, I've had women get pregnant with 0, okay? So it's completely possible to get pregnant with your own eggs with low AMH. I hope you're getting the memo. All right, what else? Root causes of FSH. Let's look at low FSH. So the low FSH can be associated with stress. I often see, you know, how do I say this? Anorexia, body dysmorphia, you know, low body weight is another way of putting it. Amenorrhea, you know, where we've got anovulation, not ovulating. Pituitary problems. So this can be people from, you know, over-exercising, really strung out types, wound up. It could be, you know, post-pill PCOS, you know, this could be an issue. Now, I've seen great improvements with vitamin C because its effects on the increasing the luteinizing hormone, releasing hormone. If we're looking at root causes of high FSH, so, you know, don't just think peri. Everyone goes straight for peri or menopause. I mean, no, not necessarily. Think adrenal fatigue. Think, is there thyroid, hypothyroidism? Is there low levels of DHEA? All right, don't just think I'm in menopause. You're not, all right? It's not that. We have to look at the big picture, broad umbrella. And it's, you know, we just come down with the gauntlet all the time. You know, it's over. It's always over until it's not. And that's where I step in, because I show you and open the veils of what's possible. And I see it every day, especially because I'm working in this niche of women over 40. And so, you know, there's a lot of adrenal fatigue. And if we can fix that or address, you know, the thyroid issues or supplement with the DHEA, you know, things can improve very, very quickly. All right. I've seen even things like, you know, adding vitamin E, melatonin. These are some other supplements that can improve high FSH levels and can lower them down. I love acupuncture for high FSH, you know, regular weekly. Sometimes you might need to do it weekly. If you've got your FSH 50s, in the 50s, 60s, 70s, I have one lady above 70, and bring it down to 20. Like we got it down to 20 with just 2 months of, you know, I had to see her 3 times a week, but it was like, all right, that was in 2 months of work, 2 months of you know, following the process. So how committed are you to the process? That's what I want to ask. You know, do you just give up, or do you dive in and do the work? So let's look at the impact of stress, diet, and lifestyle. So I'm going to look at how these can help you optimize the numbers. As I've mentioned, chronic stress, you know, it elevates the cortisol, disrupts the balance of the, you know, reproductive hormones. So we need to address the stress. So cortisol, you know, it suppresses that hypothalamic pituitary, we call it the HPO, hypothalamic pituitary ovarian axis. This axis needs to be cybernetic. It needs to be in a loop. It needs to be working properly. And so when that's shut down, cortisol goes up, FSH goes up, AMH goes down. I mean, it's just the byproduct of what happens with chronic stress. So what can we do to, you know, reduce your stress? So mindfulness meditation, like plenty of apps nowadays on, you know, Amazon, your app store, like you've got Headspace, we've got the Calm app, we've got, you know, I love Matthew McConaughey's voice. You know, if anyone loves him, you listen to him at night if you're having sleeping problems, and it's going to help reduce your stress. I mean, I would love Matthew McConaughey to read to me every night. But, you know, Insight Timer, what else? Mindful IVF, we've got Fertile Calm, we've even got Circle and Bloom, and My Mindful Me. There's another one called Expecting. So look at these apps. Start to play around with some mindfulness meditation and be guided into meditation. If you haven't got a meditation practice, I mean, when I'm teaching meditation initially, it's just one hand on the heart, one hand on the womb space, and it's literally just letting your belly rise and fall with the breath. So start when you're horizontal because you've got gravity to assist you, but when you're sitting erect, you know, let the belly come in and out. All right, so you feel your hand coming in and out. Keep the hand on the heart still, because a lot of people go, they're breathing too much into their chest and they're creating anxiety. What we want to do is breathe into the belly and breathe like people that play the trombone and wind instruments. All right, they breathe into their belly like opera singers. Anyone that can sing gospel, they know how to sing and breathe into their belly. So, you know, learning these techniques, we can open up our lungs. And if you have anxiety, learning to breathe this way, that's amazing. And anyone that's doing this process, I tell you, they all suffer from a little dose of anxiety. You know, it might be a little bit, sometimes it's extreme. So we want to know how to do the pattern interrupt, and breathing and mindfulness techniques are the way to get us there. We've also got yoga and breathing exercises. I love yoga. I'm a yoga instructor, and I teach breathing exercises to all my patients, like alternate nostril breathing. I was teaching a beautiful, beautiful Renata this morning, the alternate nostril breathing. We had a beautiful, like, I mean, I do it with them. So, but, you know, by association, that infinity wave, I actually get a healing of myself, you know, so I go along for the journey with you, and it's wonderful. All right. And then it's about teaching what you learn, because then you lock it into the subconscious. But acupuncture, I can't stress this enough for, you know, if you're going down the route of IVF or you're doing it naturally, but it's going to reduce stress, it's going to reduce anxiety, and it's going to positively affect the outcome and influence your hormones. Let's look at diet. We want a nutrient-dense diet for hormone health. So we want whole foods, carbs, protein, healthy fats. You know, these are the essential building blocks of embryos. We need these key nutrients with a special focus on omega-3 fatty acids. You know, you find that in fatty fish, flax seeds, walnuts, all right? And these to reduce inflammation. A lot of us, you know, our emotions are inflammatory. So it reduces inflammation. It supports the hormones. We need good fats, and omega-3s are awesome for that. We want lots of antioxidants. So antioxidants are found in your berries and your leafy greens and your nuts and your seeds, and they protect your eggs from oxidative damage. So we need a ton of antioxidants, right? That's going to help improve your egg quality. And let me tell you, you can improve your egg quality. All right, vitamin D, as I've said, all your vitamin D rich foods, as well as sun gazing and sun exposure, or just even, you know, using 5,000 to 10,000 IU of vitamin D. But vitamin D rich foods like fatty fish, egg yolks, fortified foods are some examples. The main takeaway with food is, and its role with high FSH and low AMH, is we want to limit processed foods. We want to limit sugars, because it leads to inflammation, right? It leads to insulin resistance. It leads to, you know, often estrogen dominance. And then we've got the cascade of, you know, affecting the ovarian function. So we want to limit those and reduce caffeine, smoking, alcohol. Out the door, off you go. Pass it on to the neighbors. But, you know, if you are smoking, you're having a problem with it, then read Alan Carr's book, The Easy Way to Stop Smoking. Put the cigarette in your mouth as you read the book. That's what they tell you to do. And I've worked in drug and alcohol rehabilitation. I've seen people read Alan Carr's book, The Easy Way to Stop Smoking, and they have once you understand the psychology of why you smoke and how you smoke and how it affects the body, you realize that it actually takes a strong person to smoke. See, a lot of us, we feel so weak because we're doing these things that are harming our fertility. But it's about education. It's about awareness. It's about increase the dose of loving kindness. That's what we need to do. More love, increase the dose. So lifestyle changes to optimize regular physical activity. We want to not overdo. I think that's just the main takeaway with the exercise. Excessive exercise is going to have the opposite effect. So no hot yoga. It's too stimulating, too drying. All right. It's going to tax the cortisol and it's going to graze it. Go for your yin, go for the Iyengar practice, go for the static holds if you're doing yoga. We don't want to overdo it. If you're running, interval running. If we're walking at a walking pace, we call it andante in music, at a walking pace. But, you know, walking, I call it time and feet. It's the best thing, 30 minutes a day. I love strength training for fertility. It's incredible. It promotes overall health, and without putting undue stress on the body, it builds the bone density. Like, it's just awesome. We need to be strong to go into labor. So weight training is amazing. We want to prioritize sleep and rest. I've said that. Establish a healthy sleep routine. If you haven't done that, just even going to bed at the same time, getting up at the same time. All right. It's in turn, like we are a computer. It's like rinse and repeat. Why do we put children into schools? It's to teach them a routine and a structure while their brains are developing. We're no different. So we want to give our bodies structure, and our hormones will follow suit. All right, I'm going to dive in. I know I've kept this a little long, but it's a big topic. From a Chinese medicine perspective, you know, we're always looking at the differential diagnosis in Chinese medicine. Now, a lot of you don't understand that, but not everybody with low AMH gets the same herbs, because it could be kidney Jing deficiency. Now, you know, things like, you know, I might see overwork, stress, chronic illness with Jing deficiency, or, you know, sore back, you know, bone things going on. I might use things like Zolgui-1 and Yogi-1. These are formulas we use in Chinese medicine for Jing and essence, because, you know, the kidneys in Chinese medicine, they're the foundation of your fertility. You know, the kidneys, they store the essence, they govern growth, development, aging, reproduction. So low AMH in Chinese medicine is often seen as a sign of diminished kidney Jing and essence. So, you know, there's like the lower back. These are the points I would use on the lower back. We call that the gate of vitality. Do for bladder 23, bladder 52. It's this whole line across the back shoe points. If we're looking at the front, it's just 4 finger breadths below the navel. Ren 4, it's on the conception vessel. It's basically your womb space. So, you know, low AMH, it can be kidney essence deficiency. It could be blood deficiency. So if I'm nourishing the blood, then it might be something like Siwa tongue. I'd be using, you know, command points like bladder 17, stomach 36. These are all blood nourishing points in acupuncture. You know, there's liver qi stagnation. Sometimes it can be, you know, we're so stressed. So in Chinese medicine, the liver is involved in the smooth flow of qi and blood in the body. So chronic emotional stress can lead to, you know, chronic liver qi stagnation. And that can, you know, it's not a direct cause of low AMH, but liver qi stagnation can exacerbate underlying deficiencies. So, you know, I'll use a lot of points on the liver, like below the breast, like liver 14, or down on the big toe, just between the junction of the big toe and second toe. At the fork of those metatarsal bones, we call it liver 3. If I'm looking at FSH from a TCM perspective, you know, we've got differential diagnosis of kidney yin deficiency. I might use Liu Di Huang Wan. This is a formula we use for this pattern. This is when the FSH is really high, or Zhi Di Huang Wan. And again, I'd be using those points that I mentioned above. Similarly, we might have yang deficiency, kidney yang deficiency. You know, it's not necessarily high FSH is coming from yin with empty heat. Sometimes it comes from coldness. It's less common, but high FSH can be related to the kidney yang deficiency. So that's where the body's warming and activating energy is insufficient. Now, this can impair the function of the ovaries. So this can lead to the hormonal imbalances. So I'd be looking at Yogui 1 and Jingui Shenqi 1. These are tonifying kidney yang tonics. All right, this is when a patient might have cold hands and cold feet. They might have frequent urination, low libido, lower back pain, lots of fatigue, but it's that coldness. All right, but I'm going to finish with some success stories, because I've had the privilege of working with many women who've had faced these exact challenges, and they've gone on to conceive. Right, I had this patient. I'm just going to call her Sarah to give her a name. It's actually not Sarah, but I'm going to call her Sarah because Sarah's one of my favorite names. I was actually going to be called Sarah. My mother chose to call me Fiona. So Sarah was my first doll. So this patient, I'm going to call her Sarah. She was 42. She'd been trying to conceive for 2 years. Now, she got diagnosed when she came to see me on her patient intake form, low AMH, 0.4 nanograms per milliliter. Her FSH was 15, okay, international units per milliliter. She was devastated, absolutely devastated. Her doctors told her chances of conceiving naturally, they were slim, and even IVF might not be successful due to her low ovarian reserve. But she wasn't ready to give up on her dream, and neither was I. So she came to see me, and we explored, you know, we put a protocol in place. You know, we have a treatment plan. We customized her Chinese herbs. You know, we diagnosed her, improved her blood flow. We got her doing her castor oil packs. We changed the diet, got to do a food diary. You know, she implemented everything, more leafy greens, seeds. We got her seed cycling. We reduced her stress. She was doing her breathing. She was meditating. Her sleep improved. Everything improved. Her whole health, her life was just, she was a different person. We got her to do her PreConception multi, her omega-3 fatty acids, her magnesium, her CoQ10, her vitamin D. She didn't need DHEA supplementation. But the journey, you know, it took the first few months, you know, it took time. Within 6 months, we got her FSH down to 9. All right. And then, you know, it was literally a month after that. So 6.5 months, you know, she missed a period. So it was, I don't think she was expecting it. And I love this, you know, so she gave birth to a healthy girl at 43, just almost 44. So she attributes her success to Chinese medicine, and not only helped her hormones, but debunked and blew the myths out of the sky. You know, and she's testament to the power of Chinese medicine in addressing complex fertility issues like low AMH and high FSH. Now, it's not going to offer instant results. That's the thing with Chinese medicine. It's a time thing, and it was you know, it was holistic. It was integrative. But she invested in the process, and that's what I love about her. Now, the second case study, I am still in process and progress. I'm going to call her Celia. She's 43. Her FSH was 20, all right, in September, and now it's 3.4. So what's that, September? almost 11 months, you know. Now she had no period, like we're talking no period, almost, you know, like Western medicine had deemed her almost in menopause, you know, but now we've got her cycling with Chinese medicine and regular acupuncture, weekly acupuncture. Her cycles are 26 to 28 days. She's on a holiday right now. I'm hoping that she's in her fertile zone right now. Anyway, we don't know what the outcome of this is going to be, but I'm just trying to show you that it takes time. And I think the best advice I can give you is time. Give yourself time to implement the protocols, time to give your body to heal and to invest and to believe in that organic power of yourself, and that with the right input that you can all change the outcome. I just want you to know that AMH and FSH, they're just fertility markers. They don't define your fertility potential. Now, I would like to hear from you. So if you have any questions about anything I've discussed today, please feel free to ask. I'm going to open up the Q&A. Would anyone like to ask me a question? Would anyone like to unmute?
Hi, Dr. Fiona. I have a question. So at the fertility clinic, they have you be at the clinic 6 a.m. for blood work. And sometimes the night before I don't sleep well because I'm anxious to go to get the blood work. And then my FSH sometimes, well, I guess if you don't sleep well, does it affect your FSH? Like I have FSH as high as 15, but then as low as 7. So I think it's related to sleep. Do you think so?
Yeah, absolutely. It can. Yeah, we're organic living matter. Like it'd be interesting to do a study on that. And I wonder if there are studies on that based on, you know, clearly it would be interesting to see how quickly it changes. Generally not overnight, but I'm sure it has a massive impact on it. Indeed. Yeah. Yeah, so to answer the question, I don't have the answer to that, if it's overnight, if it's that quick. You know, normally I would expect it to be quite static, you know, for a week or two at a time. So it's kind of, you know, you're getting a base marker systemically. I think one kind of spike of stress, I don't think it's going to change the outcome too much. I don't think it's like it peaks and falls that rapidly overnight. But in saying that, you know, we want you to go into it so you're feeling your best self. We want you to go into it without having the anxiety. So if you are doing the test away from home, that maybe you set up the environment. So you take, you know, diffusers and take your talismans with you. So, you know, can you have your sleepy time tea? You know, can you do these wonderful things before you go in for your serum testing? Would be my recommendation. Yeah. This is where you're.
My anxiety is like I don't want to miss the appointment. So I'm like, is it time yet? No. Is it time yet? That's the whole thing.
So you've probably got interrupted sleep as well.
That's right. Yes.
Yeah. I understand. Yeah, it's not an ideal situation. Is there a reason they do it so early?
They have all their patients come between 6 a.m. and 8 o'clock.
Really?
So I have, and the clinic is an hour and a half from me. So I have to take a night at the hotel room. And then, I'm like, and it's like, okay, I'm here. I made it. I'm in bed. But then I'm like, there's still the anxiety. I'm like, don't miss it, Renata. I don't miss it. That's it.
That's incredibly stressful. I mean, I think even when you sleep away, if you're not even doing testing the next day, I mean, I often have interrupted sleep and anxiety, you know, so I hear you. I feel you. We've just got to put some things in place so that you can go into these protocols and testings your best self. So I find legs up the wall even. I love this in yoga because it aids that venous blood return back to the heart. And you can do some belly breathing, you know, just, you know, breath control, apply some of these strategies, see if you can change the outcome in that way.
Yeah, that sounds good. Yeah, thanks.
You're welcome. Jessica, do you have a question for me? You usually have great questions for me.
Right now.
Can you unmute yourself, Jessica?
Oh. Can you hear me?
Now I can.
Hello?
Hello.
Oh, okay. I was
I can hear you. You're breaking up again. We've lost you.
Oh, I'm sorry.
Sorry. Amy, maybe you might have a question. Do you have a question?
Oh, I'm okay for today.
Oh, you're okay. That's beautiful. What's been your, Jamie, maybe give me your recap, your key takeaway from today. Can you give me a key takeaway? What have you learned?
Oh, me?
Yeah, what's been the key takeaway from today?
I think that I don't know the letter names, but the AMH and they're not so like defining factors.
Beautiful. That's it, ladies. You know, we've covered a lot of ground today, from understanding what low AMH and high FSH mean, and holistic alternatives, treatment options. I think, you know, just know that there are alternatives to outcomes. Don't throw the baby out with the bathwater. Trust in your body. Ask more questions, because, you know, often we can fix problems and we don't even know that there's solutions to problems. But I think by having these forums where we can just open up the conversation, because I think we all just think, oh, if my AMH is below 1, I've got fertility issues, and I hope that from today you've learned that that's not the case. So I want to thank you all for joining me. Does anyone want to put their hand up? One last call out for any questions anyone may have. Then I'm going to say, I hope you found this session helpful. Don't forget to join me next week. Thank you for spending time with me. Remember, you're not alone on this journey, and there's always hope. Bye, ladies. See you next week. Thank you.